We absolutely lean in and we try to, but we've got to put the patient in the center. And so my father's journey has inspired me to get into healthcare, and it's the fire that continues to keep me committed to the healthcare industry because we save lives every day, and we're so proud and grateful to have the opportunity to do that. But we want to get it right every time for every patient, and that's going to involve listening to them and involving them in the care plans.
So let me shift the conversation back to something that you said earlier about serving 5 million members. What internal mindset shift most prepared you for that kind of task?
Was blessed to start at the bedside as a registered nurse. And so, I had the privilege of taking care of one patient at a time or one critically ill newborn at a time. And that same perspective that I had with the patient in the center as a caregiver is what has prepared me, no matter what scale or size of membership that we have that I'm responsible for, we got to put the patient in the center. And so that's the mindset that I bring to it. And that's why I'm so excited about where healthcare is now, because it's becoming much more individualized, and we're able to understand through AI and digital technology each individual patient and what their unique needs are. And, it's our responsibility to try to meet them where they are.
So as a Black Latino woman, because most people don't know that you're Black and Latino, as an executive in healthcare, what are some of the unspoken battles you face, and how have you leveraged those moments into wisdom?
Yeah, it's a great question. I have found myself at many points in my career being the only young person early on, being the only minority or a Black Latina in the room, sitting in boardrooms with folks that didn't look like me. And at first I found that a challenge. I thought, okay, how do I find my voice when I have a different perspective? Then I was able to learn how to flip that on its head because I had a different perspective, because I came to the table with a unique viewpoint. It was, one, my responsibility to get it out there and to have it heard. And two, I recognized that when I spoke, because I was saying something unique and different, it was going to be remembered. And so I started using what I thought was a difficulty to be my greatest strength. And I knew that when I spoke, it would be heard. So I made sure that when I spoke, it had purpose. And so that's been kind of my way of navigating through being the only. And now I'm grateful that I'm not the only. We're still not where we need to be. We still need to have more, in healthcare in particular, more leaders that look like the communities that we serve. So again, we can be individualized to those unique needs, and we can address health disparities that exist in certain communities. But I'm glad to see that we've opened doors and we're bringing others along, and that's my responsibility to continue to build that legacy of other leaders that look like the communities we serve.
So Kaiser Permanente is both mission-driven and data-intensive. So how do you lead at the intersection of innovation and compassion? Because most people can only do either or, not both